The opioid epidemic is a serious problem. Fentanyl is making it worse. This powerful drug is everywhere. It's cheap and highly addictive. People often take it unknowingly. They think they're taking something else. This is how overdoses happen. Fentanyl overdoses can be deadly, but knowing first aid can make a difference. It can save a life. We all need to know what to do. This guide will teach you how to help. You'll learn how to recognize an overdose. You'll know how to give naloxone, and you'll be prepared to perform CPR. Remember, time is critical. Every second counts. Let's work together to fight this epidemic. Fentanyl overdoses can happen quickly. It's vital to recognize the signs. These signs mean someone needs help immediately. First, look at their breathing. Is it very slow or erratic? They might even stop breathing altogether. This is extremely dangerous. Next, check their pupils. Pinpoint pupils, like tiny dots, are a telltale sign. This drug affects how the eyes react to light. Also, feel their skin. Is it cold and clammy to the touch? This change in temperature is a red flag. Finally, notice their alertness. Are they extremely drowsy? Are they nodding off or difficult to wake up? This could be a sign of a fentanyl overdose. In serious cases, the person might become unconscious. Every second counts when these signs appear. Suspect a fentanyl overdose? Don't hesitate. Call 911 immediately. Tell them it's a possible overdose. Be clear and direct. Explain the situation quickly. Describe the person's symptoms. Tell them if the person is conscious or not. Listen carefully to the 911 operator. They are trained to guide you. Follow their instructions precisely. Don't be afraid to ask questions if you're unsure. They will help you provide the necessary information. Remember, every second matters. Your call can make the difference between life and death. Naloxone is a medication. It reverses the effects of opioid overdoses. It's safe and effective. It can be a lifesaver. Naloxone comes in two forms. There's a nasal spray and an injectable form. Both are easy to use. You can get naloxone without a prescription. Pharmacies carry it. You can also find it at community health centers. Keep naloxone on hand if you know someone at risk. It's essential for anyone who uses opioids. It's also crucial for family and friends. Learning how to use naloxone is easy. It's a simple procedure that can save a life. Section 5. Step-by-step guide, using nasal spray naloxone. Naloxone nasal spray is user-friendly. Here's how it works. First, get the person lying on their back. Take the naloxone nasal spray out of its package. Hold the spray device with your thumb on the bottom and your fingers on the plunger. Tilt the person's head back gently. This opens up their airway. Insert the tip of the nozzle into one nostril. Push the plunger firmly to release the medication. The medication will take effect quickly. You should see signs of improvement. Section 6. When one dose isn't enough, the need for multiple administrations. Sometimes one dose of naloxone isn't enough. This is because fentanyl is potent. The person might need a second dose. Wait 2 to 3 minutes after the first dose. If the person is still unresponsive, give them a second dose. Use the other nostril for the second dose. This ensures the medication is properly absorbed. Remember, it's better to give too much naloxone than not enough. There are no harmful side effects. Keep monitoring their breathing. If their condition worsens or there's no improvement, be ready to give another dose. Section 7. Breathing for life, performing CPR during an overdose. CPR can be a lifesaver during an overdose. It stands for cardiopulmonary resuscitation. It helps keep blood flowing. If the person isn't breathing, start CPR immediately. First, place your hands on the center of their chest. Push down hard and fast. Compress their chest at least 2 inches deep. The rhythm is crucial. Give 2 breaths after every 30 compressions. Tilt their head back and lift their chin. Seal your mouth over theirs and blow. Continue CPR until help arrives. Don't stop until paramedics take over. Your actions can make all the difference. Section 8. Staying alert. Post-naloxone care and monitoring. Naloxone wears off after 30 to 90 minutes. The person might need more medication. They need to go to the hospital. Stay with the person after they wake up. Keep them awake and talking. Reassure them that help is on the way. Monitor their breathing closely. Be prepared to administer another dose of naloxone if needed. Talk to the paramedics when they arrive. Tell them what happened. Explain what you saw and what you did. Section 9. Seeking professional help. Why medical attention is crucial. Even if naloxone works, the person needs medical attention. Fentanyl stays in the system longer than naloxone. Going to the hospital ensures they're stable. Doctors can monitor them and provide any necessary treatment. They might need additional naloxone. They might have other medical needs requiring attention. Don't let the person leave after regaining consciousness. They need professional care to ensure a full recovery. Explain to them why going to the hospital is crucial. Their life could depend on it. Section 10. Prevention is key. Reducing the risk of fentanyl overdose. Preventing fentanyl overdoses is paramount. Here are some ways to reduce the risk. Never use drugs alone. Have someone with you who can call for help if needed. Avoid taking pills from unknown sources. Counterfeit pills often contain fentanyl. Carry naloxone if you or someone you know uses opioids. It's a lifesaver in case of an overdose. Talk to your doctor about the risks of opioids. Explore alternative pain management options if needed. Section 11. Be prepared, save a life. Your role in the fight against overdoses. We all have a role to play in the fight against overdoses. By being prepared, we can make a difference. Learn the signs of a fentanyl overdose. Know how to administer naloxone. Don't be afraid to act quickly. Share this information with your friends and family. The more people who are aware, the more lives we can save. Remember, every life is precious. Let's work together to prevent overdoses and keep our communities safe. Your actions can make a difference.